Blood, a fluid so vital, so essential to life, that the mere sight of it makes some people faint. But for you as a first responder, dealing with blood is just a part of the job, an everyday occurrence that you may have taken for granted. Thanks to a decade of reoccurring news reports, we all know that blood and other body fluids can carry the human immunodeficiency virus, or HIV, the virus that causes the dreaded disease, AIDS. What many do not realize is that acquired immune deficiency syndrome is not the only blood-borne disease threatening first responders. In fact, the Centers for Disease Control estimates that the hepatitis B virus, or HBV, infects approximately 8,700 healthcare workers a year, resulting in more than 400 hospitalizations and 200 deaths. The Federal Occupational Safety and Health Administration, or OSHA, has issued a standard that can protect you in your workplace environment. It explains ways that you and your employer can work together to substantially reduce or even eliminate your risk of contracting a blood-borne disease on the job. Hepatitis means inflammation of the liver. Among the most common causes are several different viruses, including the hepatitis B virus, or HBV. If you become infected with HBV, your symptoms can range from flu-like to so severe that you require hospitalization. Or you may have no symptoms at all. So it's not surprising that many first responders are unaware that they've been infected with HBV. Yet if you have this disease, your blood is highly contagious even if you have no symptoms. The virus can also spread through contact with other body fluids. This means you could transmit HBV to your sexual partners and to family members, even unborn infants. In most cases, the disease responds well to supportive treatment. In others, progressive destruction of the liver cells leads to cirrhosis and almost certain death. But even after many years of chronic hepatitis, some people still develop no symptoms. For them, the disorder can be detected only by blood tests. The HIV virus attacks the body's immune system. A person infected with HIV may simply carry the virus and remain in apparently normal health for several years. Yet most people infected with HIV will eventually develop AIDS. In the early stages, symptoms include fever, diarrhea, and fatigue. HIV-infected individuals who develop AIDS may also develop neurological problems, cancer, and other opportunistic infections. Although these secondary infections often respond to medical treatment, patients with AIDS have so far followed a pattern of repeated infections, leading to eventual death. Currently, there is no vaccine to prevent infection. As different as the outcomes of blood-borne diseases may be, the way they are transmitted is essentially the same. As a first responder, it is imperative that you are aware of the body fluids which transmit the diseases. HBV, HIV, and other pathogens may be present in blood and other materials, including body fluids such as semen, vaginal secretions, cerebrospinal fluid, synovial fluid, pleural fluid, peritoneal fluid, pericardial fluid, amniotic fluid, and any other body fluids visibly contaminated with blood. Unfixed tissue or organs other than intact skin from living or dead humans. Blood-borne pathogens may enter your body and infect you through a variety of means, including an accidental injury with a sharp object that is contaminated with infectious material. Sharps include not only needles and scalpels, but also broken glass, anything that can pierce, puncture, or cut your skin. Open cuts, nicks, and skin abrasions, even dermatitis and acne, also provide portals of entry for infection. or infection can enter your body through the mucous membranes of your mouth, eyes, or nose. Blood-borne diseases also can be transmitted indirectly. This may happen if you touch an object or surface contaminated with blood or other infectious material, and then transfer the infectious material to your mouth, eyes, nose, or open skin. Sound far-fetched? Not at all. Contaminated environmental surfaces are a major mode of HBV. Believe it or not, HBV can survive on environmental surfaces dried and at room temperatures for at least 1 week. What's more, surfaces and objects can be heavily contaminated by substances such as serum or plasma without showing visible signs. Grim as all this may seem, just by understanding the risks you face, you're taking an important step toward protecting yourself against blood-borne pathogens. A good place to start is with your employer's written exposure control plan. A copy of this plan is available for you to consult upon request. In it, your employer identifies employees covered by the OSHA blood-borne pathogen standard. You do not have to be a medical professional to be covered. The important thing is this: you are covered by the standard if it is reasonably anticipated that you could be exposed to blood or other potentially infectious materials as a result of performing your job duties. Next, the exposure control plan describes what measures will be taken to minimize your risk of exposure and what procedures to follow if there is an exposure incident. There are a number of different approaches to reducing your risk of exposure to blood-borne pathogens on the job. These include engineering controls, employee work practices, personal protective equipment, housekeeping, and administration of the hepatitis B vaccine. Keep in mind that none of these approaches is 100% effective. Yet used together, they are like having a series of 5 protective barriers or shields, like your personal fail-safe system against infection. Most approaches to infection control are based on a concept called universal precautions. Many people can carry blood-borne diseases yet have no visible symptoms and no knowledge of their disease. You can't tell for sure by taking medical histories or by examination. If you're not a qualified first responder, stay with the victim until help arrives, but do not expose yourself to blood or other potentially infectious body fluids. In some circumstances, it may be difficult or impossible to tell whether a body fluid is potentially infectious. For example, EMTs giving aid to an injured worker covered with oil or other industrial fluid might find it difficult to tell what's blood and what is not. When in doubt, treat all fluids or body fluids as potentially infectious. Engineering controls are your first protective barrier against contact with blood or other infectious materials. Your employer will institute physical or mechanical type systems that eliminate hazards at their source, such as self-sheathing needles and portable sharps containers. Yet the effectiveness of these engineering controls sometimes depends on what you do. For example, a sharps disposal container provides no protection if you insist on recapping needles by hand and disposing them elsewhere. This brings us to your next protective barrier: work practice controls. Work practices are specific procedures you must follow on the job to reduce your exposure to blood or other potentially infectious materials. Good work practices help prevent needle sticks, one of the most common ways blood-borne diseases are transmitted on the job. To prevent needle sticks, do not bend, recap, shear, or break contaminated needles and other sharps. Immediately after using, place contaminated sharps, whether disposable or reusable, in an appropriate puncture-resistant, leak-proof container. Another effective work practice control is also one of the most basic. Wash your hands. If infectious material does get on your hands, the sooner you wash it off, the less your chance of becoming infected. Hand washing also keeps you from transferring contamination to other areas of your body or the environment. Of course, it is not practical to install hand washing facilities in some work areas, such as this emergency medical van. In such instances, your employer will provide an appropriate antiseptic hand cleanser or antiseptic towelettes. Use these as a temporary measure only. You must still wash your hands with soap and running water as soon as you can. If skin on your hands or any other part of your body comes in direct contact with blood, wash the contaminated area with non-abrasive soap as soon as possible. If mucous membranes are exposed, flush with water as soon as possible. Here are some controls based on personal hygiene that must also be followed. When performing procedures involving blood or other potentially infectious materials, you must minimize splashing, spraying, spattering, and generation of droplets. Do not eat, drink, smoke, apply cosmetics or lip balms, or handle contact lenses where there is a reasonable likelihood of occupational exposure. It is okay to apply hand cream as long as you thoroughly wash your hands first. But stay away from petroleum-based lubricants which may eat through latex gloves. Don't keep food and drink in refrigerators, freezers, shelves, cabinets, or on countertops or bench tops where blood or other potentially infectious materials are present. Personal protective equipment, or PPE, is your third barrier. Equipment that protects you from contact with blood or other potentially infectious materials may include gloves, gowns, face shields, protective eyewear and masks, mouthpieces, resuscitation bags, or other ventilation devices. Know your job, degree of exposure, and dress appropriately for the occasion. Appropriate means that under normal work conditions, protective equipment must not let blood or other potentially infectious materials contact your work clothes, street clothes, undergarments, skin, or mucous membranes. Your employer will issue personal protective equipment or make it readily accessible at your worksite. In addition, your employer will maintain, replace, or dispose of any protective equipment at no cost to you. You and your employer must work together to ensure that your protective equipment does its job. First, you must be trained to use the equipment properly. Second, as we saw, it must be appropriate for the task. Third, the equipment must fit properly. This is especially important with gloves. And if you are allergic to latex or nylon gloves, your employer will provide hypoallergenic gloves, glove liners, powderless gloves, or another alternative. Fourth, all equipment must be free of physical flaws that could compromise safety. Finally, you must use appropriate protective equipment each time you perform a task. If even one of these conditions is not fully met, you are at risk. If, when wearing equipment, it becomes penetrated by blood or other potentially infectious materials, remove it as soon as possible. After you finish with the emergency, remove all protective equipment and place in the designated area or container for washing, decontamination, or disposal. Two types of personal protective equipment deserve special mention. The first is mechanical emergency respiratory devices and pocket masks designed to isolate you from contact with victims' saliva and body fluids. Avoid unprotected mouth-to-mouth resuscitation. The patient may have blood or other infectious materials in the mouth, or may expel them during resuscitation. Remember, 1 cubic centimeter of HBV contaminated blood can contain 100 million infectious particles of HBV. The second type of equipment is gloves, the most widely used and basic form of personal protective equipment. Treat all blood as infectious and always wear gloves. Gloves may be made of latex or nylon, or heavy-duty utility gloves for housekeeping. Since gloves can be torn or punctured by sharps, cover any hand cuts with bandages before being gloved. Replace disposable single-use gloves, such as latex or nylon examination gloves, as soon as practical if they're contaminated, or as soon as feasible if they're torn, punctured, or no longer offer barrier protection. Never wash or decontaminate this type of glove for reuse. Utility gloves may be decontaminated or reused if they're not cracked, peeling, torn, punctured, and if they otherwise offer barrier protection. Finally, be careful when removing gloves. While both hands are gloved, peel one glove off from top to bottom and hold it in the gloved hand. With the exposed hand, peel the second glove from the top, tucking the first glove inside the second. Dispose of the entire bundle promptly. As we have seen, no barrier is 100% effective, so hand washing after glove removal is critical. One of the best ways to protect yourself from HBV infection is to roll up your sleeve. If you are exposed to blood and other potentially infectious materials on the job, your employer will make the hepatitis B vaccination available at no cost to you. The vaccines used today are not only safe, they are 85 to 97% effective at protecting you from getting HBV or becoming a carrier for 9 years or longer if the series is completed. The fifth and final protective barrier is housekeeping. Good housekeeping protects every first responder, and it is every worker's responsibility. For example, a contaminated sharp carelessly discarded on the seat of an ambulance. A coworker comes along and sits on the sharp, exposing himself to a possible disease. Your facility's exposure control plan will list specific methods and regular schedules for cleaning environmental surfaces possibly contaminated with potentially infectious materials. Here are some general rules. All equipment and environmental working surfaces must be cleaned and decontaminated with an appropriate disinfectant as soon as possible after contact with blood or other potentially infectious materials, and at the end of each emergency call. Protective coverings on equipment or surfaces may be replaced when contaminated, or at the end of the work shift if contaminated during the shift. Use a broom and dustpan or tongs to pick up broken glass, not your hands. Contaminated sharps and other potentially infectious wastes must be placed in labeled or color-coded leak-proof containers that are closable and easily accessible to those who use them. Containers should not be allowed to overfill. Handle contaminated laundry as little as possible and with minimal agitation. Place in labeled or color-coded bags or containers at locations where it is used without sorting or rinsing. Use leak-proof bags to transport wet laundry. Wear gloves and other appropriate personal protective equipment if you work with contaminated laundry. The blood-borne pathogen standard has these additional provisions to protect you. If you're exposed, report the incident to your supervisor as soon as possible. If you consent, your employer will provide you with a confidential medical evaluation, blood tests, post-exposure preventive treatment if available, and follow-up counseling. Be on the lookout for fluorescent orange-red labels, red bags, and containers. They warn you when the contents of containers used for waste, storage, or shipping contain blood or other potentially infectious materials. A sign with a fluorescent orange-red biohazard sign lists special requirements for entering HIV or HBV research facilities. And finally, your employer will provide you with a free training program during working hours before you assume a job with occupational exposure and annually thereafter. You will learn more about bloodborne diseases and how to use personal protective equipment and report an exposure incident, as well as your rights and responsibilities as a worker. It takes a certain fortitude and dedication to work as a first responder. No, you don't faint at the sight of blood, neither do you shrink at facing new challenges. Protecting yourself from bloodborne diseases on the job requires knowing the facts and taking sensible precautions. Working together with your employer, you can do it. As a first responder, you can be confident in your ability to care safely for the well-being of others and yourself.